Well, good afternoon, everybody. I am Grant Colfax, the Director of Health for San Francisco, and I'm thrilled to be with all of you today to commemorate this very important milestone. Today, we are celebrating the reopening of a vital community resource to the Castro-Mission neighborhoods. The Castro-Mission Health Center. Congratulations, everyone. And we're here today because of all of you. The supporters and champions of this renovation, and I am joined today by key leaders who made this day possible. Thank you to our Honorable Mayor London Breed, Supervisor Mandelman, who is on his way, Public Work Director Carlos Short, and Castro-Mission Center patient Shai Shaw. Thank you for your leadership. This newly renovated health center fully integrates a primary care model with comprehensive behavioral health services and a focus on Latinx and LGBTQI communities. And because of all of you and your input, we were able to get creative, making better use of the space we had. We added upgraded and larger patient rooms, and we now have space for our Gender Health San Francisco program, which will move into the health center later this fall. And I was just upstairs. It's remarkable what we have. We have rooms for patient exams. We have separate behavioral health rooms. We have rooms for podiatry. And I remember the days where you had one room and you had like 10 things that you had to do in that room, and you all had to figure out how you're going to get it all done in one time. So fantastic to see this space. Today, we celebrate and look forward to the future. We are also here to honor the past and the important role the Castro-Mission Health Center has played in our city. For example, it is a part of the important legacy of community-driven health services, which are the foundation of the health department, and that started in 1965. In fact, this was the first public health center in San Francisco and was formerly known as Health Center 1. And the legacy continued, and especially during the HIV/AIDS epidemic, where the work that was done here was foundational in developing what is nationally and internationally known as the San Francisco model. So amazing work that continues on, and we continue to work every day at the Department of Public Health and through this clinic to protect and promote the health and wellness of everyone in San Francisco. Thank you, Mayor Breed, for your leadership. Your commitment continues to be critical as we deliver on our core mission of protecting and promoting health. And I also want to thank Director Carlos Short and her colleagues at the Department of Public Works and the construction team for this truly remarkable renovation. I also applaud the team at the Castro-Mission Health Center, especially Medical Director here, Dr. Joanna Evelyn. Fantastic work. We're just talking about all the innovations she's bringing to the team. Nurse Manager Ricardo Duarte, longtime alum of Department of Public Health, worked in this building since the early 90s, amazing work. And thank you also to the DPH Facilities Capital team for all their tremendous work behind the scenes to getting us where we stand today. And before we close, going back to the mayor, I want to note that the mayor was instrumental in the funding of this renovation. She made sure that the 2016 Public Health and Safety Bond passed, and she even helped write it. So thank you, Mayor Breed, for being so engaged. And that bond is continuing to provide vital support for health services. And with that, it is my honor to introduce Mayor London Breed.
Thank you, Dr. Colfax, and it's so great to be here. And I just want to express my profound appreciation to the people of San Francisco for supporting bond measures that come before them time and time again, which make it possible for us to do much needed renovations on places like the Castro-Mission Health Center. When I look around at all the folks here today, I know that this is more than just a health center. This is a community. People who work here in particular really, truly believe in helping and supporting the needs of their patients. And we know that there is not a one-size-fits-all, that we have in San Francisco a very diverse community with diverse needs, both physical challenges and physical needs to make sure that we support and promote healthy people, but also mental health has really taken a forefront in terms of the conversations that people want to have, the services they want the city to provide, And now with this beautiful new health center and its great infrastructure, we know that it's going to meet the needs of people in this community and throughout San Francisco who need people, especially in the healthcare industry, that understand when someone talks to their doctor, they want to feel that they can trust their doctor, and their doctor is not going to tell them what they need, but listen to what they say they need. And make sure that, for example, if someone is in need of gender-conforming surgery, that they make the referral and provide support every step of the way. Hormonal therapy and things that are not necessarily provided in hospitals all over this country. The fact that we have it here in a community clinic where there are no questions asked, where people's confidentiality is protected, where people are supported and uplifted is really remarkable. And I'm so proud of San Francisco for always, time and time again, we put our money where our mouth is. We invest in the things that we know are important. It's not just this building, but it's also the people who choose to come here every single day and do this extraordinary work. And again, the voters who time and time again realize the significance of a project like this and the need to protect our public assets and to make sure that these buildings get protected. When you go to voters sometimes and you talk about underground and pipes and all the work that needs to be done and how expensive it is, they immediately say yes. Yes, we support that. Yes, we support protecting San Francisco and San Franciscans and the things that serve the people of this city. So I'm really glad to be here, and I'm really grateful to the architects and the folks who work on this project. There were a lot of jobs created as a result, even though we've still been experiencing some challenging times during the pandemic. I want to thank the dedicated staff who, especially during the pandemic, continue to put their lives on the line and show up time and time again to support the patients of this city and to be a real partner. And I want to just really thank Carla Short on the Department of Public Works and her team for leading this effort. This is a great facility, and it really is a great example of all the wonderful things that we do in San Francisco. We want to shine a light on the good things. We want to make sure we uplift the things that we're doing right, and this is a prime example of that. So thank you all so much for being here to join us to showcase this wonderful space and hopefully spread the word to people throughout the communities of San Francisco that this is their healthcare center, the first in the city since 1965, before any of us was born. This facility has been supporting and protecting and uplifting San Franciscans in the healthcare world for decades, and I'm so glad to be here today to see it fully restored. So Supervisor Mandelman is not necessarily late. He is in committee conducting city business, so he has a really good excuse for not being here, but he's been a wonderful partner in this community and providing and pushing for services, and hopefully he'll make it before we're done. But in the meantime, I wanted to introduce the director of the Department of Public Works who's helped to move this project forward as aggressively as we can get it moved forward in bureaucratic years. Ladies and gentlemen, please welcome Carla Short.
Thank you, Mayor. Good afternoon, everyone. Thank you, Mayor, and thank you, Dr. Colfax. My name is Carla Short. I'm the interim director for San Francisco Public Works, and I'm so honored to be here to mark the completion of the newly renovated Castro-Mission Health Center. I think I get to say the mayor's 4 favorite words. We completed this project on time and on budget. Yes. During a global pandemic, so a real achievement. I think you've all heard how important this clinic is to the community, but I just want to highlight the diverse communities of patients that have played a vital role in the Castro and Mission neighborhood for decades. The upgrades that our project team was able to deliver will ensure that these communities continue to get the excellent care that they deserve. So I do want to recognize the Public Works team, our landscape architecture team, our construction management team, and our project management team who worked on this renovation to see it through completion. I also want to really thank you. Yes. I want to really acknowledge and thank our great partners in the Department of Public Health who had the vision and the commitment to deliver health care at a neighborhood level. And as we heard, this was the very first neighborhood health center. It's capital improvement projects like these that directly benefit the well-being of our residents, and we can all take pride in these projects. Our city's priorities are in the right place when it comes to investing in accessible health care. And as everyone has said, I want to echo the thanks to our San Francisco voters who share that value and supported the health bond that helped make this a reality. And now I have the real honor of introducing someone who knows firsthand the importance of health centers like this one. Shai Shaw has been a patient of the Castro-Mission Health Center since she was 17, half of her life. She has also been with Gender Health SF since its inception a dozen years ago. Shai is a community activist, role model, confidant, and friend to many in the LGBT community. She serves as a strong beacon of support for many trans women going through their affirmation process and helps them navigate the health system. She's a tremendous community resource. Please welcome Shai Shaw.
Thank you, thank you. Thank you, Carla, for that wonderful introduction. Thank you, Mayor London Breed, and everybody for coming today. I'm kind of nervous, you guys. Well, I would like to thank everybody for coming out, and also thank Castro-Mission for my journey that I have went through. I can honestly say when I was 17, growing up in the Castro, just running around, just having fun, introducing, getting to know people, getting to know myself, I ran into a young lady named Jasmine, and I was like, okay, well, where can we go get health services for our community? And she was like, there's a clinic right down the street, you passed it. I was like, no, I didn't. So she gave me a card, and I can honestly say that changed my life. That one card, calling and getting the phone calls, calling me back saying, you can come in. And first person I met was Esteban. And Esteban told me, thank you, yes. He has been tremendous with my journey. His first words to me was, how old are you? 17. Well, unfortunately, I can't help you right now. We need your parents. I was like, why? I'm grown. But now me being older, I understand why. And I have to honestly say the staff here does a great job with helping the youth and helping people. I have been through every program they have, starting at the Mission Health Clinic for Youth, going to Gender SF, now here at Castro-Mission, and I've just been here trying to help everybody. And that's my goal, is to see everybody get the help they need in the service in this wonderful new building, because I know if Dr. Brown, God rest her soul, if she was here, she will probably just be flabbergasted about the new building. But thank you for coming, and I like it.
All right. Well, I think with that, we are ready to cut the red ribbon, which.
Did you want to say something about the clinic?
Oh, well, yeah, please.
They're the ones who run.
Yeah, okay, let's do it. Please. So it is my honor to introduce clinical leaders, Dr. Evelyn and nurse manager Ricardo Duarte, who have done a phenomenal job. This clinic reopened at the end of last month in August. The clinic was over at Zuckerberg San Francisco Hospital for 3 years, and they didn't miss a beat. So just want to acknowledge and thank them for their flexibility and leadership, and please.
On behalf of Castro-Mission, we just want to say bienvenidos. We are thrilled to be home. We serve very diverse communities that know what it's like to be underdogs and know what it's like to feel like they don't have a place. And we're glad to be their medical home, their behavioral health home. We feel like we're just getting started here, and just cannot say enough wonderful things about our team, who works so hard every day, most of whom were deployed during COVID and worked across the city, and we're so glad to be back here together. Thank you.
And I would like to also thank everyone for being here. This is a long time coming. We've always asked staff here, and I know every single one of you, I've known many others before you, the one driving force has been we were always trying to be the best we could for our patients. And that still continues. We did it in the old building. We did it at 81. We're going to do even a better job here. We're so proud of this building. It makes us so efficient, so nice. It's the best that we could that we can get. And a great building is nothing without a great team. And you guys are what is driving us higher and higher and higher. And our patients are the ones who actually feel the difference. They've always felt the love. They've always felt the love. The love's still here. This love will continue. But now we have love, efficiency, beautifulness. Wow. So thank you, everyone. And we love this building. Thank you for everything you've done for us, for our community. And the Latinos are happy to come here, too. Yes. Thank you.